Hello, this video will talk about the primary stress hormone, glucocorticoids, cortisol. Glucocorticoids name is a portmanteau of gluco, for glucose, corti, for cortex, coids, for steroid, as they are steroid hormones secreted by adrenal cortex. During periods of stress, cortisol increases blood glucose level and enhances brain's use of glucose. Cortisol is secreted into the blood where 90% are bound to cortisol-binding globulin, and 10% are free and active. Cortisol-binding globulin plays an important role in regulating cortisol delivery and clearance. For example, dexamethasone has low affinity for cortisol-binding globulin, so it more potent pharmacologically. Active cortisol freely diffuse into the cell, where it binds to cytoplasmic glucocorticoids receptor to form complex that translocate to the nucleus. They interact with DNA to induce or repress protein synthesis, such as it inhibits inflammatory protein synthesis. Thus glucocorticoids produce a delayed but profound anti-inflammatory effect. Glucocorticoids have become important agents for use in the treatment of many inflammatory, immunologic, hematologic, and other disorders. This has stimulated the development of many synthetic steroids as hydrocortisone, cortisone, prednisone, prednisolone, dexamethasone, and hydrocortisone. These synthetic agents have different, special features that are pharmacologically and therapeutically important. As in comparison to the hydrocortisone, which is identical to cortisol produced by the adrenal gland, with weak mineralocorticoid effects. And it is short-acting, available as oral, injection, topical forms. The cortisone is nearly similar to hydrocortisone, but requires activation in the liver, so it is not active topically. Prednisolone, its glucocorticoid effects are 5 times more than hydrocortisone, and its mineralocorticoids effect are half as potent. It is intermediate acting, available as oral, injection forms. Prednisone is nearly similar to prednisolone, but requires activation in the liver. Dexamethasone, its glucocorticoid effects are 30 times more than hydrocortisone with no mineralocorticoids effects. It is long-acting, available as oral injection, topical forms. Hydrocortisone, it is a mineralocorticoid, has a long duration of action and significant glucocorticoid activity, available orally. According to the differences in the glucocorticoids and mineralocorticoids effects of these synthetic agents, they differ in their clinical uses. We will talk about the clinical uses of glucocorticoids in 2 parts. First in adrenal disorders. Then in non-adrenal disorders. In adrenal disorders we will talk above, adrenal insufficiency either acute or chronic, and congenital adrenal hyperplasia. Adrenal insufficiency results from inadequate secretion of cortisol and aldosterone. First, cases of acute adrenal insufficiency, which is life-threatening state. It is mostly caused by severe stress or sudden withdrawal of chronic glucocorticoid therapy. These patients must be treated immediately with large amount of parenteral hydrocortisone. In addition to correction of fluid and electrolytes. Patients with Addison's disease, chronic adrenal insufficiency, they are treated with hydrocortisone that must be given daily with increased amount during periods of stress plus hydrocortisone, which has high mineralocorticoid effect to maintain normal blood pressure. In second adrenal disorder, congenital adrenal hyperplasia, patients have defect in 21-beta-hydroxylase activity. This defect will lead to a reduction in cortisol synthesis, thus produce a compensatory increase in ACTH release. The gland become hyperplastic and produces abnormally large amount of androgen, lead to precocious puberty in male and ambiguous genitalia in female. They are treated with hydrocortisone to replace deficient glucocorticoids and to suppress ACTH-driven adrenal androgen production. Hydrocortisone should also be administered to maintain normal blood pressure and electrolytes. This was the common adrenal disorders. In other hand, there are many non-adrenal disorders respond to glucocorticoids, some of these inflammatory or immunologic in nature, as asthma, organ transplant rejection, collagen disease, rheumatoid disorders. Other application include hematopoietic cancers, neurological disorders, chemotherapy-induced vomiting, hypercalcemia. Dexamethasone used to reduce high intracranial pressure. Do you know why do we choose it? As it has no mineralocorticoid effects. Betamethasone is given to pregnant women in premature labor to achieve maturation of fetal lung. Betamethasone is chosen because it is highly cross the placenta. Adverse effects of glucocorticoids are common to all members of the group. Effect on metabolism. Chronic administration causes iatrogenic Cushing syndrome characterized by moon-shaped face and buffalo hump, and cause hyperglycemia. Effects on CNS. They cause neuro-psychiatric symptoms. On bone they cause osteoporosis due to the ability of glucocorticoids to suppress calcium absorption, inhibit bone formation and decrease sex hormone synthesis. On muscles myopathy and muscle weakness. Stomach, peptic ulcers, as glucocorticoids inhibit the protective prostaglandins in the stomach. On eyes cause cataract and glaucoma. Also they cause growth suppression and hypertension. Thanks for watching.